Peel Public Health, that's in the Brampton, Mississauga area, they have confirmed a positive case of rabies in a bat in the Peel region. And then we were looking as well at other news out of the Peterborough area, down in the Kawarthas area, the Peterborough Public Health Unit, reporting increased bat exposures this summer. So based on that, timely conversation for you this morning with infectious diseases specialist Dr. Isaac Bogoch. Good morning. It's always good to see you from Toronto or wherever you are. Hi, Dr. Bogoch, and welcome back.
Good morning, Heather.
You know, whenever we get these headlines, you and I always take the time to remind people about rabies. It's important to take that opportunity. Why is it so important when it comes to rabies, Dr. Bogoch?
There's a few reasons. The first and most important is a rabies infection is universally fatal. We don't want to see anyone get exposed to rabies, and we know that if someone does get exposed to rabies, it can be prevented if they seek timely care. The second point is that we have animals in Canada, namely bats, that carry the virus. So exposures to bats, and of course other animals as well, but primarily bats in Canada, are potential rabies exposures. That doesn't have to be just a bite. It can also be a scratch. Fortunately, it's very, very rare to acquire rabies in Canada, but since the year 2000, there have been 6 locally acquired cases in the country, all of them from bat exposures, and sadly, all of them fatal. It's a much more common infection elsewhere in the world, but even in Canada, we still have this virus and we have to take it seriously.
So you mentioned a couple of things that we can spend some more time on in detail, but that phrase, universally fatal, that does tend to make you snap to attention. Universally fatal if left untreated. Just remind us, how does rabies affect the body, Dr. Bogoch?
So after a bite or a scratch, the saliva from an infected animal, usually a bat if it's in Canada or elsewhere in North America, but dogs, rabies is very common elsewhere in the world. That infected saliva gets into our body, it gets into the peripheral nerves, and it travels up the peripheral nervous system into the central nervous system, then it travels up to the brain, and it causes a fatal inflammation of the brain. It impacts parts of the brain that are associated with controlling vital functions like breathing, blood pressure, and people will sadly universally succumb to this illness. It's an awful, awful death. And again, it's totally preventable. And the key points here, if someone has a bite or a scratch from a bat or a dog or a wild animal, it's very important to wash that area off right away with soap and water and just seek medical care. You know, maybe it's an exposure, maybe it's not an exposure, but speaking with a medical provider can help tease that out. And if it is deemed to be an exposure, we have the right vaccines and other products in Canada to prevent any possible exposure from turning into an actual rabies infection and having a fatal outcome.
You know, I remember in previous cases, there's been a bat in a cottage or a home and no awareness whether there was a bite or a scratch, but unfortunately did progress in those situations. Is it better, if you don't know, to err on the side of caution?
100%. And this is actually a very common scenario. It's hot in the summer, windows are open, and someone finds a bat in the house. And even complicating matters even further, maybe it's in a room with a child, and the child's not old enough to verbalize if there was any contact with the bat. Again, if there's any questions whatsoever, you talk to a doctor about this. It's worthwhile talking to a doctor and promptly, because there's so many different permeations of what can happen. Was this an exposure? Was it not an exposure? What are the possible risks involved? You just chat with a healthcare provider to help sort of tease your way through various situations. And if it is deemed to be an exposure, we give what's called post-exposure prophylaxis, which is a series of vaccines.
Tell us about that.
It works.
So what does treatment involve then? Vaccines or shots?
Yeah, exactly. There's 2 products. One is a vaccine, and the other is something called rabies immunoglobulin. But if those 2 products are administered, the probability of actually getting a rabies infection is negligible. And of course, we have access to this in Canada. What's really important, though, is, rabies is much more common in many other parts of the world, especially lower income countries. And access to those products can be limited. So it's very important if people are traveling, if they've had an exposure as well, to be able to seek prompt medical care, usually in a larger city where they have a hospital or a healthcare center that has access to these products. Occasionally, people might even have to leave the country of the bite and travel to another country or even back to Canada to have access to these vaccines and this immunoglobulin, because it might not be available in many lower income countries in the world.
That's an important reminder, too. You keep saying promptly, timely. Obviously, the sooner the better, immediately attending to these. Bats tend to be maligned for all sorts of reasons, so we probably should pause and say, they're an important part of the ecosystem, and only less than or thereabouts 1% of bats are believed to carry the rabies virus, and skunks, foxes, coyotes, other animals, raccoons, they too can carry rabies as we take a look at the incidence in Canada. But bats are the most common source, that's for sure, of human rabies cases. It does, though, bear reminding about how to handle interactions with, as you said, Dr. Bogoch, animals in the wild animals.
Yeah, I think a good rule of thumb is don't touch them. If they're healthy or if they're unhealthy or sick, just don't touch them. And sometimes people on their property might have a dead bat or another dead animal. And believe it or not, there's actually pretty good surveillance in most parts of Canada for these animals to see if rabies was indeed a factor in that animal's death. But again, you can use a shovel, or if you need help, get someone else to help. But you can promptly discard of these animals without physically touching them, because some of them will have died because of rabies. But again, fortunately, it's rather rare in Canada, but it does exist. And, sadly, there's been some tragic recent cases in Canada of someone who's had a scratch or a bite, always from a bat. But of course, you mentioned other animals that have the potential to carry this virus, and these have had fatal outcomes as well. The key here is recognizing if there has been an exposure. That's the key, because sometimes it's not obvious, but if there's been an exposure, seek care, get the right vaccines, and everyone will be okay.
Thank you, Dr. Bogoch. I always appreciate visiting with you. Dr. Isaac Bogoch from Toronto. This is CBC Morning Live.